Um, okay, well, we're going to go ahead and get started, and this is being recorded, so if you have colleagues from your health department who join late and miss the beginning, they can always go back and listen to the recording. We are a Berkeley Media Studies group, and this webinar is on using social media to advance health equity. It's a webinar specifically for the health departments in the San Joaquin Valley Public Health Consortium. We have a grant from the California Endowment to work with you all to build capacity around communicating specifically around racial and health equity. And this webinar came out of feedback. For many of you, we met when we did an in-person training, and the evaluation, social media was one area you wanted support on. So we love to hear your feedback and what you need, and that helps tailor what we do with you. And we have this funding until 2021, so we just want to reiterate that we're really interested in hearing what else we can do. It doesn't have to be webinars. We can think about other ways to work with you all, but we definitely want to keep thinking about how we partner with you to advance your health equity work. We'll go over some of the logistics of the webinar, but first we'll introduce ourselves. So my name's Kathy Schaaf, and I've met many of you. I am the Health Equity Coordinator here at Berkeley Media Studies Group, and my background is really working with health departments. Was at Alameda County Public Health Department in Oakland for 11 years, and then before that was at the National Association of County and City Health Officials. So I'm super into everything about local health departments and excited to be talking with you all again.
Hi everyone, and my name is Shaddai Martinez Cuestas, and I am a Strategic Communications Specialist here at the MSG, and most of my job is to provide technical assistance, do trainings, and consultations with a lot of the groups that we work with, so I'm happy to be here supporting Kathy. And just to give you a little bit of background, for me, my work comes from the HIV world. I work in HIV prevention and HIV care, and managing a clinic in San Francisco. And yeah, I'm very excited to be here today.
So for those who are new, or just a reminder, Berkeley Media Studies Group, we've been around about 25 years. We really focus on building the capacity of advocates, youth, all types of people working towards social justice and public health to more effectively communicate about the issues they care about. So this includes researching issues that are in the news, everything from housing to immigration to sexual violence, doing trainings and webinars along with longer-term technical assistance for public health folks, and then we also do education for journalists and recommendations as well. And the webinar, you can go ahead. For today, if you experience any technical difficulties, this is the number that you want to call. Heather is also supporting us. She's our person who helps run our webinars here at Berkeley Media Studies Group, and she's in the background but managing everything. So you can, she'll be putting this in chat. You can send a message through her to the chat box, and that will be under the Berkeley Media person. And so if you need anything, she's there to help. And then for the chat function, this is one thing that's just particular to WebEx that's really important. If you want us to see your questions, you have to message all participants. If you message all attendees, we won't see it, unfortunately. So we'll be trying to answer a lot of your questions, and just want to make sure you send it to all participants. So today, again, this came out of an evaluation from when we worked with you in person. We did another webinar on building relationships with reporters, and what we heard from you all is that a lot of you are working in some challenging media markets and political context where, you know, the local newspaper might only come out once a week. It's hard to get stories in there. You may have limited opportunities in your health department to pitch news articles, and so social media might be an important vehicle for you all to supplement your health equity work. And of course, it's not the only strategy, but it's one way to continue to communicate about racial and health equity. So based on what we heard from you today, we're going to work on describing how an overall strategy drives your social media strategies. A lot of you have already heard about that, but we just want to reiterate that. We'll talk about some social media best practices, and we'll outline some media tactics you can use to advance your advocacy and mobilizing goals. And a lot of you filled out a survey, which was really helpful. And the things you mentioned you wanted were tips for posts, so we'll get to that. Also using social media for policy and systems change, and how social media fits into a broader health equity work, and examples from other health departments. So that's what we'll really be focused on today. And also, just write questions during, and we'll definitely have some Q&A at the end. So before we really dive into the content, one of the things we really focus on at Berkeley Media Studies Group is practicing. We know, just like playing a sport or a musical instrument, the best thing you can do to improve your communication capacity and skills is practice. And so we want to start off right away with that. If you do have Twitter, we'd love for you to log in another browser, and you can tweet throughout using the hashtag BMSGtips if you hear something you're interested in. If you are not on Twitter and you don't have an account, you can still go to Twitter and search the hashtag BMSGtips to see what other people are posting. We don't recommend setting up an account now because it'll be a little bit distracting, but if you're an avid Twitter user, we'd love for you to post so people can see how you typically post. And if you're one of the people who maybe started an account but is nervous and has never posted anything, this could be your day to post your first tweet. So we really encourage that, and we'd be interested in using it to learn what you think is most interesting about the webinar.
And we'll show at the end for folks who are not able to log in or look at Twitter right now, we can also share our screens to show what people posted. So let's move on to the content. So what we want to talk about, what we want to start talking about today is what is media advocacy. And if you have had a training with us before, you've probably seen this before, this slide. But we want to describe what we mean by media advocacy. And while a lot of our work does focus on the news media, we think, we will see it the same way in terms of talking about social media. In other words, it is a tool that you can use strategically to create change in the environments that you are in. So it is one part of what it takes to advance the things that we think we need for healthy communities, but we strongly believe that it needs to be tied and integrated with your policy strategy, your community organizing, and any other efforts that you're involved in. So we always like to say, and we start with, the media is never first. Your message is never first. First thing is your overall strategy. So we at BMSG have created this tool called the Layers of Strategy, and it's really a guiding tool for you to organize your work and see where the media fits in. And so the first layer that you can see on the slide is the overall strategy. So that layer is going to determine how and when you're going to engage with the media. And again, we often talk about the news, but how and when are you going to engage with social media? Your message strategy will come next, and how you're going to frame your problem that you're talking about, and how what you're going to say to and to whom. And lastly, the access strategy is how you get media attention, or in this case, how you generate attention, or how do you generate content that is engaging for folks on your social media page. So there's a lot to learn about social media, and I do want to say, that it is constantly changing, and we highly recommend that you spend time online observing. We will not be able to cover everything in 1 hour webinar, but we will give you pointers, ideas, and key best practices so that you're successful in incorporating this social media to your overall strategy. So moving on to the overall strategy, again, what you see in social media is really the tip of the iceberg. There's a lot of work that goes behind what you see on social media, and it's ideally integrated with your goals and with the rest of the work that you are doing. So you can think about these set of questions as an organizing tool and once this is done, or once you have clarity on these things, what the problem is, what is the solution that you're seeking, who is the person or the group that needs to take action to change that, who are your allies that are going to support you and be behind you when you're asking for change, and what actions you're going to take. All of these things need to be clarified first before you start deciding how to engage with social media, before you start thinking about launching a campaign. Essentially is what it is that you want to see, how you're going to go about it, and who are you trying to reach. So we're going to walk through an example today and through the webinar so that it is a little bit more clear what we mean. Cassie's going to show us an example.
So this is coming from the time that I spent at Alameda County Public Health Department, and I think there's a lot of opportunity for health departments to advance their use of social media. I would say we were in the midst of learning. This is not a perfect example, and there's so much more we could have done with more resources, but we were able to use it to supplement a lot of our health equity work that was focused around local policy. So our start was through a Facebook page for an initiative called Place Matters that was focused on local policy change around economics, education, housing, land use, transportation, and criminal justice. And when we first started, we had to do a lot of internal work to build our own staff capacity, to understand these issues, to gather data and research, and to really start building the relationships and partnerships. So, we had a few years before we really got deeply engaged in the actual policy, but we still started with a social media presence, partly because it was required by a funder that we were working with. So for those of you who may have trouble getting social media approved, for us it was helpful. It was before our county had social media guidelines, but it was helpful having a funder require it, so you could ask your funders to require you to have a page if that might be helpful in persuading folks that you need to start a programmatic or an initiative page. And so this was a page for our particular initiative and not for the whole health department. And so at first, Shaddai talked about having an overall strategy, and we really usually try to get people to be pretty concrete in their solutions. Like, we want this rent control policy to pass at this meeting. But to be honest, when we were starting, we didn't have that clarity in our solutions, but we still really tried to have a goal for our social media rather than just throwing stuff out there. And that goal, our overall strategy at that point, was really to build the capacity of our health department and our partners to understand and address the social determinants of health and their racial, class, gender, and other inequities that drive their distribution through local policy. So again, at first it was really mostly reactive policy work. People started asking us to present data at meetings or testimony related to policy. We released a report called Unnatural Causes. But over the course of the initiative, we started developing multiple smaller overall strategies that we'll talk about later. And so we built our social media audience before and as we were sort of getting our bearings, and then once we had something with a real call to action, we already had a bit of a base and an audience. Social media was never the foremost way of reaching people. We would have sign-in sheets at all of our events. Some of the examples are here. We'd have lunchtime events, and everyone would say that they heard about it through more relationships, an email, a call. So those individual relationships absolutely matter, but we saw social media as amplifying, reminding folks, and highlighting our partners to sort of honor the hard work they were doing.
So some of the stuff that Cassie was talking about touches on our media strategy, which is a second layer of our tool. And, it involves identifying what are the best methods to communicate with your target. It may not be social media, and like Cassie said, you could have, email lists or other ways to communicate with your target or with the people that you're trying to engage. And then you can decide, and depending again on what you're trying to do and what your overall strategy is, if engaging with the media will help you advance your goals. Find the media that will reach your targets. We will talk a lot about which platforms there are out there and how each of them can be different in reaching different types of populations. And lastly, media tactics, we'll go over some social media tactics that can be effective for building engagement. So before we do that, we do want to talk about what's the role in that, something that you need to determine in your work. What is the role of your social media page and whether you can do these two different things? So on the one side, on the left side, we have the public education sort of role that most of us in public health are familiar with, where you would be communicating with the public about, things like, immunizations or risk communications or even campaigns like eating fruits and vegetables and things like that. So the focus of this type of communication is usually to educate your audience and to inspire some sort of personal change. And social media can certainly be a useful way to put these messages out. However, we are here to talk about how do we create change that improves health and that and we're talking about health equity, and we believe that we do need to have some sort of bigger systems change to create that, and that is a little bit different. This may or may not sound too big for you, and there are different ways that you can build towards creating systems change using social media. And like Kathy was saying, like you can start just creating engagement with a base and building a base, and so when it's time for you to call people to action, you already have an established presence and you have folks who are ready to go. So this will be an important determination for you. So how do you want to use this social media? And you could try to do both, but we do think they're different and may be tricky to manage, since the tone, the content will be different. So once you determine which one you're going to pick or how you're going to manage this, we think it's important that you decide then which platform is going to be the best for you. So we want to share you some information that can be useful in determining which platform. So this data is from earlier this year, so it's the most recent that we have, where you can see that YouTube and Facebook are still at the top of the most used platforms. So if you are trying to reach a wide audience, then you may want to choose something like Facebook. But there are other considerations that you can think of in deciding which platform you're going to use. So for example, a lot of us, we're using Twitter for an example today. However, there's not that many people using Twitter as people using Facebook. The content is a little bit different since it's limited, but it's more reactive in time. In terms of, for example, of audience, you can have a different type of audience, and like younger audiences are using more of Instagram and Snapchat, but that's not a high percentage of the usage of social media platforms overall. So all of these things you will need to determine who is the audience that you're trying to reach, and then decide which platform you're going to use. You don't have to use them all, and we don't encourage you to do that. We would say that you try to do one that makes more sense to you and the audience that you're trying to reach, and then spend good time and energy working on building that platform's presence. So again, you need to decide, what you're trying to do with the platform, who are you trying to reach, and what kind of content. So for example, one last thing is YouTube or Instagram are very visual, and like videos are very a big component of this, but then that takes time to create. So if you are just you and using the platform, you have a lot of other stuff, then it may not be the best one for you to use.
So going back to our initiative on Place Matters, talking a little bit about how we started and why we chose what we did. Again, This was just a small bit of our work. I'm assuming a lot of folks on the webinar, if you are already actively engaged in your health department's social media, it's probably only a portion of your job. And so for us, we really chose Facebook first because it was manageable. It was easier to think about a little bit longer posts. Twitter can be hard because it's actually so short. And, to build a base on Twitter, you generally have to be posting quite a bit. Facebook, you can post a little less often. And we also really knew that a lot of our partners were already on Facebook. And we did start this, probably about, 8 or 10 years ago. And if you go on there now, they haven't filled the position, so it's a little bit outdated. But at that point, too, Facebook was much more prominent than Twitter. We were working in Oakland, which has a dense network of nonprofits and really equity-focused community partners, and so we made our goal and our audience to reach our partners. We didn't think as an initiative of a health department, we had the capacity and were really built around doing direct community organizing ourselves. We were more working with the community organizers who were already in organizations to identify what were they working on, and they would alert us to windows of opportunity in the policy world. They would tell us, oh, this policy is not going to move because we heard this, or this is what's going to move, and we really need to get a jump on tenant protections. And we were very fortunate. They would tell us what they thought the valuable health department role was. Like, we really need you to bring data on this, or we need you, the health officer, to speak because they have a lot of authority. And so that was really driving our work. And so our audience of our social media were always our partners, because we felt if we got our resources or our data or our health framing out to them, they would be able to utilize it much more and already had the relationships with community residents. Now, if you're in an area that doesn't have that dense network of community-based organizations or partners, then your strategy may be slightly different. Your tone may be different, and you may be doing a lot more resident-driven postings, and that, you're going to have to be even more careful about jargon and all of those other things if you're posting directly to residents. If you're posting on the health department's main social media, again, it might be, as Shaddai was saying, a mix of education about immunization clinics or what to do in a fire, and you may be hitting a broad range of the population with very divergent views, so you're going to want to enter into health equity discussions really from a place of shared values, thinking about things like, we all belong to our community, and we believe that housing is a fundamental way that we can be healthy. Starting with a value place that can help bring people together, starting maybe with some less controversial messages, and then working into, some of the issues that we know that drive inequities can be contentious. If you have an initiative page, likely you're going to be able to draw more on your base and really target your partners and residents that are already interested in this, and helping them be more connected to the health department or the work you're doing. And then your tone and your actions from the beginning. Also, we still recommend starting with values in your post, but you may be able to to ramp up a little bit more what you're doing and really highlight from the get-go the equity focus. We also interspersed, clinics and things like that, because we knew our partners were working with residents who needed this information, who needed to get to clinics, and so we wanted to be able to offer something of value to folks, but we drove the content much more with really connecting to issues around health equity. If you're working in a place where things are hard to get this information out and that there's a lot of layers of approval, it may be best to think about an inside-outside strategy where you're supplying data or health research more in handouts or resources to partners, and they're driving a lot of the equity content in your jurisdiction, and maybe they call on the health department to speak or to answer these questions, but really it's allowing you to take sort of a different role than being at the forefront if at the time you haven't sort of built the political will in your jurisdiction for the health department to be out front on every issue. One more thing about our work is we really saw the goal to be supplemental. Our goal was never just to post to build social media. It was always to supplement our other health equity work. And, you know, we can get really excited about social media because it's very visual and it's sort of instant gratification. You post and you get likes. We know from a neuroscience level that attracts our brains, but it's never the end itself. It's a means to the end. Our other goals were really to build understanding of the connection between racism, classism, and otherism in social determinants of health, so that when we would post, we wouldn't just put a post up there about, you know, new poverty statistics. We'd always try to give a little context connecting the issue to health. And why do we care about poverty? And why do we care about poverty in our jurisdiction? And then again, really building a base of folks who understood why the health department was starting to get involved in things that might not seem like public health, like transit decisions or things about the educational system, so that when there was a call to action, more people would understand why is the health department at this table. You know, it's an education table or a criminal justice table. So we were working to build the warrant and terrain of public health from the beginning.
All right, so once you have your goals very clear in mind, and if you're deciding to open up a Facebook page or any, you know, whichever platform you use, we think it's really important too for you to think about these things. So these are some of our best practices recommendations for you. So the first and foremost will be to develop your guidelines. So who is going to post in your organization? How often will you post? What type of content will you post? Developing those guidelines will be useful so that you establish your presence and you establish your voice and then you establish what type of page you're creating, so that your followers will know what to expect from your page, and they'll decide whether they want to follow you or not. We also, like I said earlier, you want to spend time online. It cannot be understated, like Kathy was saying in the beginning, like if practicing is going to help you feel more comfortable with the platforms. It's going to help you see what other people are doing, how folks are responding. You will learn a lot from listening to others and observing what other people and other organizations are doing online. So definitely spend some time online. Posting regularly, we don't want you to overwhelm your audience, but we do want you to be consistent and having some sort of consistent engagement. Having a calendar or having scheduled posts can be really useful for you to have something regularly, so that people that follow you have something in some content to look at, and they continue to stay engaged with you. And engaging with your audience, you have to be intentional with the content. So whatever you're posting, thinking about how engaging it will be. And also when people respond, you remember that this is a two-way communication platform. So you will have to be engaged and respond to people's questions, or, offer insights and connect people to other resources. So definitely staying engaged with your audience. Monitoring your metrics, so you will have access to data that will tell you which posts are generating more engagement, what times of the day, which days are better, which audiences are more engaged, and you will be able to change the way that you're posting and the way that you're using the platform based on that. So it's a very useful tool, and you're not to get too deep, but just observing what's happening with the posts and the stuff that you're putting out. And lastly, but not least, is to build your network. So think about who is important for you to maintain a partnership with or maintain a relationship with, and likewise then have follow your partners, follow your supporters, and engage with their content as well. There's a lot of reciprocity happening online, so it's important that you maintain those relationships online and offline.
And just to reiterate a little bit about the metrics. For us and our initiative, I didn't come into this with an extensive background on social media when I started, but through Facebook and Twitter, when you're managing the page, you can actually click on the analytics, and it's even, I am not an epidemiologist either. I work much more on qualitative data and research, but I could definitely interpret and understand a lot of the quantitative data they put out about who our users were, what time they were viewing it, and a lot of things that were just helpful on a very basic level. Especially if you don't have much time, you don't have to necessarily at first get very extensively into using alternative programs for metrics and data. You can use what Facebook and Twitter have, and then if you really are seeing social media as a critical strategy, that would sort of be a 2.0 level, and we can talk more about that at later dates, or you can give us a call and ask more questions about managing some of those metrics. But using the metrics within the platforms is helpful. So putting it into practice again, so what our guidelines looked like within Place Matters, delineating the admin roles. I was the admin. I really tried to get other people to create content, and that was a little challenging because I think a lot of people are intimidated by social media, and so trying to write it into people's job descriptions or really bringing it up at team meetings, like, just trying to get each team lead on each social determinant to give me one thing a week that they thought was interesting, and that's a real ongoing thing where, just continually mentioning at staff meetings, it started to sink in and people started to do that more often, and then especially when we got to calls to action, they were much more likely to think about how to use social media from the beginning instead of me hearing about something that was already going on and saying, oh, it's too bad we didn't post that. So it took a long time to sort of shift the mentality, but as an admin role, just sort of reminding folks over and over that it's available, it's a strategy, and that there's making minimal effort on their part and then, following through and putting up the post. Other guidelines for us personally, we felt like we didn't want to promote things that had a cost, trainings or books or resources, unless it was something that we were engaged in directly, because we were apprehensive about, if somebody went to that and felt it wasn't worthwhile, what that would mean for our initiative. Absolutely no posting supporting or opposing elected officials. I'm pretty sure that would hold true for everyone, but for us that would have put us in a legal area that we couldn't be in as a health department. And so we could talk about an announcement an elected official made, an initiative they were pursuing, but we couldn't say that we supported or opposed them, especially during elections. For our policies, as we worked on tenant protections or rent control, we had an approval process for what we worked on that went through our health officer, and that, was way beyond social media, but that was really critical in having that infrastructure already in place. And if we had policies that had gone through that, then it was okay for us to post about those policies on social media. So it might be something about coming out to a city council meeting and share your story on rent control, but only after it had really gone through the approval process. And so if you are working on policy, those are things that will take some discussion and putting into formal guidelines. And also just knowing your department, your agency, and your county process. If it's a very restrictive process, that could be overall strategy is opening that up a bit and changing your own county process to allow you a little bit more freedom to post. And it may take a while, but you can figure out who's the decision maker and try to present some evidence that social media is a really important way to reach constituents and try to make your process a little bit easier for you to get the information out that you need to get out.
All right, so we're going to give you some tactics that you can use in your social media to mobilize folks. So like the example that we're using today would give folks a hashtag, and then they can use them, and folks can also use that to search for certain content, and people will find you via hashtag. So use a hashtag depending also on the platform. So Twitter and Instagram are more prone to using hashtags, but you can also use them on Facebook. Providing sample messages, so if you're asking folks to send tweets to an elected official, or if you're asking folks to engage in some way, then you can also provide sample messages via email or other forms. Ask your followers to share their story. That's a very powerful story crowdsourcing, and they can come with their authentic voice and share their story. You can tag reporters, you can tag your partners, you can tag people in your social media posts so that you start a conversation and a dialogue with them. Live tweet meetings can be another way to keep people engaged and to also to observe what other people are saying about those meetings. Staging a tweet storm, that's another strategy that people have used to create momentum and to have something, when a decision is being made or when something big is happening, so that a lot of people are responding at the same time. Hosting a tweet chat, that's something that we've been trying to do more recently, to have a conversation with our partners on Twitter. So I'm going over this really quick, but these are some ideas. You can be creative in the way that you use social media, and again, by observing and spending time online, you can see what other people and other organizations are doing and start building off from that.
And we can talk more about any of these tactics in the Q&A, and these are also something we encourage you to reach out to us if you're thinking of using them and want to just bounce ideas. Through the funding from California Endowment, we are here to support health departments, and we have to balance all of the requests we get, but if we can, we will definitely work to help you. So putting it to practice, again, this is an example from when we actually got more engaged in proactive policy rather than just using Facebook to educate folks. And this was really highlights the importance of partnerships. Again, this was in deep partnership with Causa Justa Just Cause. They work with tenants, and they really were the experts at policy. We talk about building community capacity, but they really built our capacity as a health department in helping us understand the policy landscape. And so we had someone on staff who had a journalism background, and she did what we call a story bank. So she photographed and interviewed people, captured compelling stories, whether they were willing to talk to a reporter or not, a lot of different information about if they were comfortable having their photos shared on social media, all of these different things. And then we used that story bank, and every day before a key vote on tenant protections, or rent control, I can't remember exactly which one this was, we would post a photo and the story and say, come share your story at City Council on Thursday. For us, it was easier to start with engaging in city policy rather than county because the sort of turfism and tension between county agencies sometimes. So as Alameda County, we started with Oakland. And also we never said vote this way on this legislation. We just said share your story. And we knew because of who we were targeting with our social media and who we had sort of cultivated, that the people who would share their story were going to take an equity focus. And again, this was with a lot of other reports, handouts, having our public information officer ready, doing a lot of the other broader media strategy that we've talked about in past trainings with you all, and social media was just one component of that. And so then Twitter was something we added much later on. We didn't tweet out a ton day to day, but where we did use it was live tweeting at City Council or other meetings. And so that can be very educational. Even if you're not allowed to tweet, you can follow, and you can really get both what's happening, even if you can't make the meeting, but you can get people's analysis. And there can be very savvy people in the room who know the history of the politics, and they're like, oh, this person's talking about this again because that's what they always talk about. And so you can learn a lot about the political landscape, and it's a great opportunity for building relationships with reporters. You can see which reporters are there, what they're tweeting. Almost every public meeting I've been to generally has a hashtag. Like in Oakland, it's Oak Meeting. And so if you can find the hashtag for your city council or your county meeting, it's very easy to follow along. And so here again, it was to lift up partners. If somebody said that rent control was needed, we try to retweet but add the health lens to it, like rent control is needed because this is how it impacts health. And then on the next slide, you can see this is just an example of some of our live tweets. And some of the people on there, so we were retweeting. This was about coal being transported through Oakland, but the person, Devin Katayama, they were a reporter for KQED. And so retweeting them is just one way to start to follow and understand who's covering these issues and cultivate that relationship. And then maybe later on they ask the health department for an interview because they realize they haven't been thinking of coal transit or rent control as a health issue, but that's an interesting angle and maybe there's a story there.
Okay, so moving forward, we wanted to point this out again about the message strategy. And so again, some of you who have been in our trainings might have seen this before, but we do think it is important to think about, okay, so what are you going to post and how you're going to think about the messages that you're going to put on your social media. So our message strategy, it talks about framing. So how do you frame the issue and how do you frame the problem that you're talking about? The messages, how you develop the messages and that reinforce and put at the fore the framing that you want. And then who is the messengers? Who are the people saying this? And so for example, when you're asking folks to share their story, then they become the messengers, and those personal stories can have a lot of power. And then lastly, who is your target? So keeping in mind who you want to hear your messages. So we want to move on to talk about our components of a message. So this is our little formula to develop effective advocacy or effective strategic messages. So first you have to define the problem and be specific about the problem that you're talking about, and then tie that to a solution. It doesn't have to be a super big policy, but tie it to a solution of what needs to be done to solve that problem. And then in the middle there, we have the value dimension. And in public health, in academia, we often feel like that facts are the reason why we do things and why that we are very rational and make decisions based on facts. But that's not often the truth. We don't move, we're not mobilized by facts. We are mobilized by values and by information that evoke those values and that speak to that and at a deeper level. So we really encourage all of you to infuse your messages with values and lead with values in your messaging. So we're going to show you a couple of examples of different messages that we put together in applying this formula. And you can use this formula to create a longer format message, but you can also do it to create a tweet. So it's just about practicing having those components in there. What's the problem, what's the solution, and why it matters.
So this is an example message. This actually was in an email and then repeated on social media through a partnership we have with Public Health Awakened. We can put their info in the chat box. They are mobilizing folks around a lot of the issues we are facing right now in our country. And so they have the ability to be pretty direct in their communication. Not everyone might be able to take this stance, but this is what they were able to do. And so you can see the values are right up front. Our country is stronger when we invest in the nation's health. Unity, interconnectedness, we're here together. We're talking about the problem, and this was really around public charge and the threat to health departments really around if public charge is implemented, it's going to change the way health departments are able to deliver services. And then the solution, 3 clear things that we wanted folks to do. So this is pretty long. It would be good for Facebook, not for Twitter. For Twitter, you know, it's a little bit harder to fit all of these components in, but you can think creatively. Can you have a hashtag with values or your solution in your hashtag? Or maybe you have to you know, have a few tweets where you get everything out there, but we really do think that it's important to try to aim to get the solution and try to aim to get some values in whatever social media messages you're trying to get out there.
And then this is another example that we have from the work that we've been doing around sexual violence prevention and how do we talk about that. And here's another example that is a little bit shorter, and you can create small links to add to direct people to get more information. But again, you can see that there's values, and then there's a concrete solution. And here we have also illustrating success because we know that it often feels that that change cannot happen or that prevention cannot happen or that it is too big. So showing success can also be a good way to show that the prevention strategy that you're proposing is viable.
And we know for, again, especially as health departments are entering into policy around social determinants, you may not have as concrete of solutions when you start. You know, that's really where we like to get to, but this is a great example of if you are moving towards that but don't have a clear policy solution, at least trying to illustrate success and name concrete solutions that are out there rather than just naming the problem. So when we put this into practice in our tips for our content, and this is from a press conference that was around Alameda County being a sanctuary county, a welcoming county, that included a tenant who was fighting back against landlord harassment, her legal representation, a supervisor who came from an immigrant family, and our health officer, and then the executive director of the Bay Area Regional Health and Equities Initiative. So photos are very helpful, visuals are helpful, highlighting our own events was really important, highlighting in this case an elected official who is championing a health equity issue was important. Other tips that we had for good content, again, connecting social issues to health. One thing we've seen in doing analysis of other folks' social media, foundations and everything is we get really used to, in our circles, using shorthand. You know, we think that health equity connections are clear, or a lot of times we'll use health equity and we know that it means racial equity and health equity, and so that's what we're putting out on social media. But if we really want to create racial equity, we need to be more explicit about that in social media. If we're talking about a public transit issue or a criminal justice issue, in our minds it might be totally clear why that's related to health, but it might not be to other folks. So, you know, really just connecting those dots over and over and over again was important, highlighting racial equity. Again, if we had other people posting, coordinating so people weren't posting at the same time. We really tried to focus on local news. People are much more interested in stuff usually happening in their jurisdiction, or if there was a national news story, we'd try to relate it back to our area. So if it was on poverty statistics nationally, we'd try to, even through a question, say, what solutions do you know about in Alameda County that are working to address poverty? Using questions can also be helpful. We've talked about this in other trainings. We can have a very narrow portrait view of the problem, one tenant fighting a landlord, and that doesn't help people see that policy as a solution. It makes it seem like the solution is maybe doing something to that landlord. So really trying to, a lot of news stories are in the portrait frame. If we posted them in our comment, we would try to draw back to the context, like, wow, this is a really moving story about a tenant. What's happening at the city level to really protect all tenants? For us, we wanted to highlight free opportunities from our partners, advocacy and action events, stuff that people could engage in, opportunities for people to give feedback into community plans, land use decisions, surveys, all sorts of things like that, and then promoting our own resources. So this is a very quick overview just of our work, and we are available to talk more. And now we want to move on to...
So we've asked you to have Twitter open if you have a Twitter account. And so we just want to hear, if some of you were there, what your takeaway from today is. We know we talked about a lot of stuff, and we probably went really fast, but it would be a good moment for you to practice. So what I'm going to do is I'm going to share my screen to show how Twitter looks, and hopefully we'll start to see your tweets there.
We already have one from San Benito, so a shout out to San Benito County. We'd love to see other people tweeting. So again, Shaddai is sharing her screen, and if you, even if you're not on Twitter, you can go to the search bar, you can put in the hashtag, the little number sign, BMSG tips, and then you can see what people are saying around this issue. So we have some other resources up there. We have, from our personal accounts, we have from BMSG, and if you scroll down, we do have one from San Benito up there. Maybe if you go to latest. And scroll down, yeah. So that's
Yay.
Great to see. We'd love to see more, and for us, this is sort of an evaluation of the webinar too. We'd love to hear what tips you are taking away. So as we're wrapping up, that's what we wanted to get across today. We can definitely go deeper into these issues in the future, but we'd love to hear any questions you have. We have a brief summary slide just to remind you that you always start with overall strategy before going into your social media strategy. Social media takes time and it's ongoing. Building a base takes a long time, building followers. That your social media strategies should align with and supplement your overall strategy, and really be driven by what audience you're trying to reach. And no matter where you're posting, you can always lead with your values.
So we have the chat box, and again, this is just a reminder to enter your questions to all participants so we all can see them. So we'll be happy we have time, and we wanted to have time dedicated for you to ask questions about what we talked about today, or maybe something that we didn't talk about but you're really curious about. So now is your time. And
also, if as we're waiting for the questions to roll in, this is a great opportunity to connect across San Joaquin Valley. If there's a health department or an initiative page that you already have and are already managing, feel free to put it in the chat box. We'll follow it here, and maybe some of the other participants will follow it, and that's how, again, we build some more networks to support each other across the region. Any questions out there? Anyone already feeling like you're doing a pretty good job and have a great example that you want to share in the chat box? Or I'd be interested in some of the biggest challenges that you see about using social media in your jurisdiction. Yes, the slides are available. We will be able to send those out.
And the webinar is being recorded too.
Yes. And that will take a week or two to be able to send out, but we'll be sending that out. We'll send an immediate message out with the evaluation, and then when the recording is done, we'll send that out with the slides. And just also to reiterate, through our work with the California Endowment, we are working closely with the 3 regional bodies in California that support health departments: the Bay Area Regional Health Inequities Initiative, the Public Health Alliance of Southern California, and the San Joaquin Valley Public Health Consortium. It looks different in all places. In the Bay Area, it's really been around immigration and housing. In Southern California, it's been around their Healthy Places Index. But we are very interested in making sure we're available to you and supporting you. We have to balance, again, all of the requests with what time we have. But if you have ideas, questions, if you're thinking about pitching to a newspaper, if you are ready to ramp up your social media, if you're getting a tricky question from a reporter, please reach out to us. And as much as we're available, we'd love to help you strategize and really think about how we can take those lessons learned and share them across the San Joaquin Valley Public Health Consortium so everyone can be collectively learning together. And
we will send, in the follow-up email, we'll also send you a list of the resources that Heather has been putting it into the chat box. And we have a resource that is a bit old, but I think it will be really interesting for those of you trying to navigate how much lobbying and online work you can do, or how to do that. So we'll be sending you a resource on that can help at least start thinking about those things.
And there's also a Robert Wood Johnson Foundation webinar that we recommend about engaging policymakers via social media that has a lot of other examples and some of the legal aspects that we know can be intimidating, but are actually things that we can work around and make sure we get, good information out there. So it looks like we don't have any questions, but we'll stay on till 1, and our information is on the very last slide. And so if you are just trying to think about how to formulate your question and haven't quite gotten to it, we'd love to hear from you. We'd love to see what you thought was a good tip on Twitter, and we'd love to stay connected. So thank you, everyone.